The next skill station that we will go over is how to treat somebody with a forearm or wrist injury. In this station, you'll need the following supplies: at least one padded board splint, 4 triangular bandages, some form of wadding or roller gauze material to assist the patient with keeping their hand in the normal anatomical position. As with every other station, the first steps are scene safety BSI. I will then have my partner come in and stabilize the injured area with my patient while I do a CSM check. I check for a pulse. I ask the patient if they can feel me touching their fingers. Can you wiggle your fingers? Once I've done CSM, I'll have my partner stabilize the injured area. The first piece of equipment I will use is some gauze or a towel, and I will place that into the patient's hand to assist him with keeping it in the normal anatomical position. The next piece of equipment I will use is a padded board splint. My partner will rotate the affected limb away from the body, allowing me to place the padded board splint along the forearm to supply support to the area. Always make sure that the padded side of the board is up against the patient. I will ask my partner to see if he can secure holding both the limb and the board so that I can grab my first triangular bandage. I will use the triangular bandage up as close to the elbow as I can, to coming around and tying the knot on the padded board side to secure the upper portion. Gently snug the area, do not over tighten. I will grab a second cravat and I will go down close to the back of the hand to the wrist area. Once again, I will go around the padded board splint and the affected limb, and I will tie the knot on the bottom side of the board. This prevents any knots up against the patient. Now I will take and make a modified sling, leaving the cravat in the rolled up position. I will come underneath the board, somewhere along the middle side to the wrist side, and come up and over the back of the patient, tying the knot on the back of the patient off to the uninjured side, away from the spinal column. I will pad the knot. And the last sling will be used as a modified swath. This will go around just above the elbow and you'll tie it off on the uninjured side. This should be snug enough to reduce movement, but not tight enough that it will reduce any of the breathing. And the last thing I do is just make sure that this limits any upward mobility. The last thing I'll do is I'll have my partner let go, and I will ask the patient, check for a pulse, ask him to wiggle his fingers, and we are complete.